Hi guys, my name is Gregory. I want to present the case which I've been doing for the last 3.5 years. Of course, everybody might say that it's not a serious case, why I present this case, but it's not just producing this nice crowns and restorations, but the most important is like people can function. So I'm presenting this case to show that what's my failures in my success in the particular patient. So this patient is 48. When she came to my office, she was 45, and she wants to change her upper front teeth 7 to 10 because aesthetically she was not pleased. But again, it's by collecting her medical history, we couldn't see any significance, and the only problem she has is she's a heavy smoker. By collecting the data on her dental history, we find out that she has popping syndrome but without pain on TMJ. She always been complaining on tension headaches 2-3 times a month with a migraine pain, and she had braces in the past, and she used to have a occlusal guard, but again, looking at the picture right now, you can see that her teeth been in malposition. She has deep bite. You see the picture right now occurring on the screen. It's after the Invisalign, but let me show you how she came to me. If you look at the screen, let me show you what the bottom teeth look like. You see, number 25 was completely facially positioned, labially positioned, and you can see on number 8 is positioned also labially. So I told you before we start any restorative procedure from 7 to 10, at least we have to do Invisalign, put it in the right position so I can align them properly. So it's going to be, we have to grind less root canals. You can see the Invisalign case, how we started, and that's how I've been playing. Again, of course, on the screen it looks pretty and beautiful, but it never happened in real life. So she came back to me with a refinement, and that's how we started a second stage of Invisalign. And let me show you what the bottom teeth look like. You see number 25 more lingually positioned, and number 8 is almost aligned with number 9. So she was wearing second Invisalign, and the whole treatment took her probably a year and probably 9 months. So the final pictures you can see on the screen right now, it's not of course what you see on Invisalign. If I would approach this case right now, I would probably go a little bit differently. But what also the patient wants at the end of the treatment, Invisalign treatment, she wants to do full rehabilitation top and bottom. Okay, and I'll show you why she made a decision. So again, it's what my point is. If we start doing full rehabilitation cases, especially on this patient, what's our reference point? How are we going to restore those teeth? Do we have to intrude those upper anterior teeth and intrude the lower anterior teeth, or we have to extrude posterior teeth? What's our reference point? And by looking at your x-ray, you look at the panoramic x-ray, you can see number 7, the post was misplaced by previous dentist. So by doing again the restoration, removing the post, there is possibility of fracture of the root. So the patient was aware of it, and we left it as is, and we changed the restoration. She also has multiple cavities. She has a leaking restoration on the number 2 and number 3. She has lately we have to extract number 31 again because the function was vertical fracture. Again, she has multiple cavities, and we have to control it. Again, I'm not going to go over the full presentation. You can see it here, lower left side maximum position, and the right side, the lateral view. So periodontally, she has only the problem between 2 and 3, like 6 millimeters right here, due to defective restorations and the cavities underneath. So On her wisdom teeth 17 and number 32 to be impacted, so we left them alone. So from biomechanical points, you can see the occlusal view. Let's say you can see the cavities on number 21 on distal, and you can see the cavities on all these teeth. Those three, it's multiple cavities. We have to control it. So the patient was on care-free products, which is trying to maintain her pH and put her more in basic environment. So how we started this case, again, it's let me show you her frontal view. See the smile, it's just a repose. You see she doesn't show her upper teeth too much because she was afraid to smile. So if we bring this picture here and when trying to probably manipulate with upper anterior teeth, how we're probably going to intrude them or extrude. So I'm going to use probably something at night that's if we're going to just intrude them, and just the software, and probably bring the gingival line a little bit higher. That'll give us a little bit free space for the lower anterior teeth for the restorations, and we have to intrude, of course, the lower anterior teeth if I probably approach this case right now. But again, it's because I didn't have that knowledge before. I didn't take any occlusion courses in the past, so I took this case. We planned with my technician. We did the wax up, but let me show you what my mistakes been when I did the wax up on this patient. You can see on the screen I've been using my Panadent articulator, and when I put my Panadent articulator on the position, for me I give the instruction to my technicians which teeth I have to increase in length and which I have to shorten. So 89 I probably shorten a little bit, a millimeter and a half, and I'll increase my back teeth a little bit to increase her bite, so we have a little bit space for the restoration. We have to increase her bite. So originally, what was the functional problem patient had? Probably constricted chewing pattern. It means when the people have a normal envelope, but the upper teeth is on the way, and that's why when people trying to put the teeth together, she started squeezing, and when she squeezed, it distalized her jaw distally, and that's why she had like a dimple on her on the disc. Again, it's just assumption of mine. It's what was happening in the past. I had no idea because she wasn't patient of mine for a long time. But you can look at these pictures how we did the wax up. We increased her vertical dimension, and the technician gave me matrix, and I've been applying to her teeth. But the problem is, probably everybody had the same problem. When you apply those temporaries, okay, it's not going to be the same bite as what you see in the articulator. You can see on this picture that's on the right side and the left side I have open bite, and I was curious why it was happening, because again we don't have a reference point how we restore those teeth. Okay, so I have to equilibrate the patient mouth in the chair, but again when you equilibrate, which teeth you have to grind and which teeth you have to leave it as is. So again, when you put the teeth to the face, that's going to give you a reference point. But again, it's my technician's mistakes, because he made those template as put them on the whole teeth, and usually has to be done. We have to do them partially. So some of the teeth which you don't going to grind is going to be like a reference point, and you restore just partially the back teeth or the front teeth. But of course you start with the front teeth to maintain your vertical dimension, and I explain to you why. So in a second, when we place those temporaries in this patient, in the same second, the patient said she feels comfortable. She doesn't feel any tension in her muscles. And she was wearing those temporaries for the next 2 months. Again, I was scared. It's probably one of my first cases, so I was afraid that she will tolerate, this increasing vertical dimension. She will be in pain, something else, and also I want to see if those restoration going to last a little bit longer. Again, she was fine for the next 2 months. She likes the shape. She feels comfortable, and that's how we proceed with the case. You can see in this picture that I prep those teeth and put them in temporaries. Okay, she's wearing those temporaries for the next probably 3-4 months. Again, I want to make sure that she is comfortable before I finish the case. And also, she started telling me that her symptoms are gone and she doesn't feel any more pain, tension, headaches, so migraine are gone. So this is a case how we start. Is my prep with the laminates on the bottom teeth and full restoration on the back, as it was EMX. The front teeth was layering technique, and the back one was pressed. But you can see the difference before and after. Now she smiles better, she feels better. But let me show you the different views on this patient. So her midline is maintained. See the position of upper anterior teeth, upper arch. They are aligned properly. The lower arch, you can see that's the last restoration I've been placing for her. That's 6 veneers. Again, the patient is of course has problem financially to afford this case, and we again did it partially. We're replacing the back teeth first, then we'll start doing the front teeth. This is a final case. You can see how we increased the bite. The midline still maintained, but you also can see a little bit blackish around the number 7. I couldn't do anything about it. Again, it's because of the post discoloration on the root, and patient is aware that so in the future, if anything happens, she has to replace with the implant. Number 31 was extracted, again due to vertical fracture, due to her function. Again, I want to present this case to show you what I had failure during the treatment and what I had a success. And I want to show you that also final x-rays. You can see panoramic x-rays before, and you can see final pictures after. You can see it's number 31. I did socket preservation, and in the future she'll come back and to place the implant. But again, let's hear what the patients say about the final treatment.
Okay, and your name?
Michelle Camus, patient of Dr. Marks. I don't know how long, 10 years.
Okay, and you've been having a procedure ongoing for about 1.5 years, correct?
Correct.
And when you first started this procedure, did you have an idea of what you wanted your teeth to look like?
Yeah, a lot better than they did look. My teeth were very bad, very yellow, very crooked. Now they're straight and they're white and no more pain.
What was some of the pain that was occurring prior?
Lots of cavities. I know that has nothing to do with the reason why I did this, but lots of root canals, grinding the teeth, got so bad, just opening my mouth hurt, my jaw would crack, migraines, just to name a few.
And how would you say everything is now after the procedure is completed?
Now, I just told Dr. Mark, haven't had a migraine since the beginning, when we started the work, knock wood. Headaches, normal headaches have subsided. pain in my mouth in the morning from grinding my teeth at night gone. So I'd say 100% improvement.
So you would say somewhat the problems you were having before affected, different health issues.
Definitely.
Okay. And you had veneers done, correct, for upper and lower?
Yes.
And would you say Dr. Mark has done a splendid job of, up to your satisfaction, of course?
Yes.
Okay. Now, do you feel any different, younger? Do you smile more?
No, I smile more, definitely. I'm still aware because for a long time I didn't smile, so it's still new.
Right.
But yeah, more confidence. I don't have to worry, I don't hide my mouth anymore when I'm talking, or, so it definitely makes me feel better.
Okay, would you mind smiling for me? And here we have Miss Camus, one of our lovely patients who has had a splendid time being in our office literally like every day.
Yeah.
But now the major work is completed and she's gorgeous and she's happy. Thank you so much.
Thank you.
For being an ongoing patient.
Thank you.
Signing off.